Yes, I'm a consultant urologist and an associate senior lecturer at the Department of Surgery and Perioperative Sciences at the Umeå University Hospital in Sweden. And I'm also associated at the Sahlgrenska University Hospital in Gothenburg. Yes, it was 72% of the patient that was included after radical prostatectomy or radiotherapy had radical prostatectomy, and about 50% of them had salvage radiotherapy before inclusion. And at the baseline, most of the patient, about 90%, were ECOG performance status 0. And at diagnosis, it was about 1/4 of the patient had a Gleason score 8 or higher. And at diagnosis, but at inclusion, they had a PSA doubling time then less than 12 months. And actually 62% of these had a PSA doubling time less than 6 months at inclusion in the trial. Prior to inclusion, the patient had to have a bone scan, and that was the imaging that was mandatory before inclusion. We have actually not looked at that analysis, and it should be very interesting to look at it. This is the primary result of the trial, and we have only performed the analysis that was that way we had the prior decided to perform due to the protocol, but in the follow-up studies we will also perform other analysis to see subgroups and also these kind of questions that you have right now question about. Yes. I think we need in the future to have a more selection due to the different aspects of the disease. I mean, novel findings have found that we have different subtypes of prostate cancer. I think we need to have individualized treatment. And I think docetaxel may be actually beneficial for some patients. I don't think that these results are enough to have any change in the practice right now. I think, of course, we need to have a follow-up to see metastasis-free survival and overall survival. And we hope and we think that it actually could, this trial will see a benefit in metastasis-free survival and overall survival as well. But it's too early to say something about that. But in the future, I think it could be possible if there is a specific treatment group that is beneficial. I think this could be very helpful for the patient.